So my name's Caitlin, and I'm here today with Compassionate Assistance. So I am the care director for Compassionate Assistance. We're a family-owned in-home care agency. We are here in Scottsdale, but we do serve all of Maricopa County. So we're family-owned, and we have over 35 years of experience on our management team. So what I want to talk to you about briefly is just go over a little bit of things about the home care industry, which obviously you're all very familiar with, and a little bit why we're different than some other home care agencies and kind of what we're doing. So first, I just want to talk about some of the biggest home care myths that we may all come across. The first one being the cost is too high. So private duty home care, it's like so much money. So that's one thing I just want to talk about is when you look at home care across the United States, Arizona is actually ranked 34th out of 50 in home care costs. So we are actually on the lower end. When you look at the median income in the United States, Arizona is ranked 30th. So we're actually a little bit higher in that ranking. And when you look at 150 cities in the United States, 4 out of the top 10 cities of income is actually in Maricopa County. But in addition to cost, I think what we really need to also look at is just the quality of care, what's really going to be the best for that patient, what's going to be the best for them when they do go home, and there is a big transition from a hospital setting to their home, and how they're going to get the care that they need. So the second myth I want to talk about is that the caregivers aren't qualified. One thing I really want to make clear, what we really focus on is we don't want our caregiver just to be a sitter, just to be somebody that's just going to sit with them and make sure that they're okay. We want our caregivers to have the education and the training to know these chronic disease identification and warning signs. So a lot of the things we talked about today, COPD, heart failure, Parkinson's, dementia, we really want our caregivers to understand what these mean, what signs to look for, and some symptoms that should be reported immediately to our agency so we can contact their home health or their mobile physician. We don't want these things to go unnoticed and get worse. Simple things as swelling ankles or shortening breath, we want our caregivers are really the ones that are with them the most throughout the day, and they're gonna know when there's changes in their condition, so we want them to be able to report those things. In addition, we're very selective with who we hire, so we actually hire 1 in 25 caregivers that we interview, and we actually offer full benefits and incentive programs to our caregivers because we know that we can't provide great care without a great team. The third myth I want to talk about is that they have family members that can take care of them when they get home. So many people might have a family member, but long term, that doesn't really usually work out. We get a ton of phone calls from family members saying they're exhausted, they don't know what to do, they don't know what's out there. And so they might have a family member in the hospital that's going to help them get home, but they also have a life too. They have a job, they have kids. So that's really where we come into, and research does show that there's negative effects on family members that are caregivers, and they've actually shown that caregivers who care for their spouse more than 14 hours a week, which we know is much more than 14 hours a week, have a higher risk for depression. A family that we cared for is a husband and wife, and the husband was on hospice, and he actually passed away when our caregiver was there. And the wife had asked our caregiver to stay with her for the rest of the night and into the morning. So that's really what we do. So what does this mean to your facility, your team, your hospital? So we have a hospital-to-home transition program where we effectively and efficiently help your patients discharge home safely. So we can help them with simple things just as getting a lockbox installed at their home. We work with the fire department as well, and we work with them and they can install a lockbox if we need to. We can have grab bars, ramps installed in their home just so that they know that when they get home, they're going to have the tools they need for a successful recovery. When we get a referral, within 1 hour we can arrive on site. We have resources, whether you call us, call me, or text me, we can be there within the hour to meet with you, to meet with the family, just discuss the options. It's really what we're there is just to educate and see if we can really help them out. Communication is huge in the healthcare industry, and that's really one of the things that we focus on. So we actually have a mobile app that allows our caregivers to report daily records when they're with the patient. And these reports are fully accessible by the family. So the family can actually have a portal on this mobile app, and they can view what's going on, what their loved one's doing, and the caregiver puts all the reports in there. In addition to this, we also have an RN on oversight on all of our care plans and all of our clients. So even though we are non-medical, we do think it's important that we have somebody overlooking these care plans and constantly looking them over monthly. So we want to provide not only the family with the peace of mind, but also the case managers and the nurses and the doctors. We want them to know that their patient is in good hands. And I can promise you we'll get it done in a smooth, ethical, and professional manner each and every time. So again, my name is Caitlin with Compassionate Assistance, and I think all of our brochures are passed out. If you call that phone number, you'll reach me or another one of our care directors, and we'd love to just better serve your patients in the community. So, thank you.